Stress. A term used to describe how a person reacts to demands placed upon him or her. It is a normal phenomenon which enables the individual to adapt to encountered situations. Will be evaluated differently depending on whether it improves or reduces performance. It's triggered by the subjective interpretation to a situation and the evaluation of capabilities to cope. A stressor is external or internal stimulus which is interpreted by an individual as being stressful. Getting uneasy will affect attention, concentration, memory, prudence. Appears not only in imminent danger, for similarity with experienced stressful situation via imagination, situation or outcome, anticipation. Physiological stressors, noise, temperature, humidity, hunger, sleep deprivation. Psychosomatic means that mental and/or emotional stressor can be manifested in organic stress reactions. Biological reaction. The organism is mobilized by a process known as general adaptation syndrome. There are 3 phases: alarm, resistance, exhaustion. The general adaptation syndrome. Alarm phase. Increased arousal level, adrenaline secretion causes increased heart rate, respiration, glucose released, decrease in stress resistance. Resistance phase. Autonomic nervous system is activated. Cortisol secretion converts fats into sugars. Appearance of psychosomatic disorders when lasting over a prolonged time. Exhaustion phase. Elimination of the excessive waste products generated. Body needs time. Promotes an increase in physical strength rather than promoting mental performance. Stress and performance. Human performance is generally better when relaxed, independent of the time of the day. Moderate level of stress may improve performance. Excessive or insufficient stress weakens performance. Optimum performance is obtained with optimum arousal. An identical situation can be experienced by a pilot as exciting in a positive sense and by another as threatening. In both cases, the arousal level will be raised. Stressors accumulate, thus increasing the likelihood of exhaustion. The relationship between arousal and performance. In-flight stress. Circumstances leading a pilot to stress. Plan of action to be revised and solution not immediately available. Inexperienced pilot when situational demands exceed individual's capabilities. Pilot convinced he will not be able to find a solution for the problem with which he is confronted. In case of in-flight stress, use all available resources of the crew. In a complex task, high levels of arousal narrow the attention span. Overstress. Acute stress quickly leads to the mobilization of resources required to cope with stress. A person being exposed to extreme or prolonged stress factors can perceive distress, stress reactions. Stress reaction is a non-specific response of the body to every demand placed on a person. Distress or overstress increases vigilance for a longer period than the stress itself, but may focus attention. Concentration is essential for pilots, however capacity for concentration is limited. Observable indications: dilated pupils, flushed skin, fast breathing, perspiration. Symptoms: resignation, frustration, rage, mental block, confusion, channeled attention, deterioration in motor coordination, high-pitched voice, and rapid speech. Behavioral effects: tendency to withdraw, inappropriate gestural agitation, manifestation of aggressiveness. Cognitive effects: excessive haste, action block, mistake rate increase, and fixation on particular aspects. Stress management. Stress management programs usually involve prevention and/or removal of the stress. Stress reaction may include various psychological and physiological elements which one can learn to manage. When suffering from chronic stress, a pilot should attempt to reduce stress by using a concept which approaches the entire body and improves wellness. If coping with a stressed situation is impossible, one will remain in the state of distress. Adaptation is a new state of equilibrium after having coped with a stressful situation.